everybody for joining us. We have the interpretation of the eye report, Brooke, Joel, and I presenting today.
Hi, I'm Brooke, so I'll get us started off. I'm a teacher of the visually impaired, and I just wanted to give you some basic background information about what some of these medical reports mean for your child. So as you know, your child has a diagnosis of Bardet-Biedl syndrome and retinitis pigmentosa, and you do have a family history of Bardet-Biedl, which I believe it's her sister who has the condition, if I'm correct, and neither of you have any ocular conditions. As far as other health history goes, she's on no medications, has no allergies, and there's no other diagnoses that we're aware of. She attends a general education middle school program, and she does have an articulation disorder that I believe she's still receiving speech services for. So let's go into some of the medical information that we got from her last eye examination. So that form that we got from you said that in her right eye, which is OD, she has an acuity of 20 out of 80, which means that what we can see at 80 feet, she needs to be 20 feet away from to see at the same acuity in her right eye. And that's the eye that she is having some more difficulties with and some more vision loss in. In OS, which is her left eye, she sees a little bit better. So what we can see at 70 feet, maybe a little over 70 feet, she can see at 20 feet. And then when she's using both eyes together, what we can see at 60 feet, or anyone with typical 20/20 vision, she needs to be 20 feet away from to see. And then her doctor did make a note that we might want to look at some low lighting considerations, and that her diagnosis currently is not expected to improve. So because her medical report was kind of sparse, we referred her to get a functional low vision evaluation where we got a lot of great information. So from what we can see, her acuity is a little bit worse in this evaluation, and that's pretty typical because in the medical evaluations, they have really the best settings possible. So they have the perfect lighting, perfect conditions, but in a more functional setting, you can see in her right eye, but we can see all the way back at 250 feet, she needs to be 20 feet away from to see. And then in her left eye, it's 20 out of 80. So what we can see at 80 feet, she needs to be 20 feet away from, and both eyes together, it's the same. What we can see at 80 feet, she needs to be 20 feet. So that means that her right eye is experiencing some more significant functional vision loss compared to the medical acuity. Near acuity, which just means that what she can look at that's really close to her face. She's able to read down to 5-point isolated numbers, which is pretty good, but she reads better with 18-point print. And then ocular motor accuracy, which really just means that we're looking at how her eyes are moving together if she's tracking an object. So if she was trying to track my pen, if I was moving it quickly, she was having some more trouble focusing on it. And then the last considerations I really wanted to go over with you were some restrictions to her visual field. So this functional low vision evaluation was showing that she has some peripheral constriction, which means that things that she can see out of the corners of her eyes on that periphery is going to be more difficult for her, and it's worse on her right side. So it's going to be more constricted on her right side than her left. There were also some inconsistent results in her central visual field. So in that central 30 degrees, really where you're looking right ahead. And that mees that we're going to want to watch out for some scotomas. Her binocular alignment was rough, which just means that aligning both of her eyes together could be a little bit more difficult at times. And she does have some reduced depth perception as well.
Hello, I'm Joel. I'm also one of the TVIs, and I will be discussing retinitis pigmentosa, what it is, and what is Bardet-Biedl, along with the types of eye conditions found and the etiology. So as you know, the patient is diagnosed with retinitis pigmentosa and Bardet-Biedl syndrome. Retinitis pigmentosa, it's a progressive visual condition which affects the retina. It leads to vision loss, and for this patient, she is experiencing difficulty seeing in low light situations, which may be attributed to loss of rod cells functioning in her retinas. It also appears that she is experiencing reduced visual acuity and field loss. The secondary condition is Bardet-Biedl, which is a rare genetic disorder with highly variable symptoms, which may include retinal degeneration, obesity, reduced kidney function, polydactyly, which are when someone has an extra limb on either their hands or feet, among many other features. As I mentioned earlier, for the eye condition, there is the rod cone dystrophy, which is the main ocular finding, and it affects both the rod and cone photoreceptors. And for the etiology, it is an inherited condition from either sides of the parents.
So in terms of your child, functional implications are really hard to sort of discuss if you've never experienced the extremes of retinitis pigmentosa. So I thought the best way that I could demonstrate that was through a quick video. And what we have here is two still shots. The first one is of a street view and an individual looking for a sign. And their eye condition represented in this video simulation is retinitis pigmentosa, and that field loss is pretty substantial. And the rods are the ones that gives you that field vision, and the cones are the ones that give you that accurate detailed vision. In this example, you'll see that the cones are even impaired in this setting, and this individual is actually looking for a street sign that says Halifax. But notice that when they were panning across the screen, Halifax, they found a sign, but they didn't necessarily see the person right beneath the sign. In the second example, the implication here is whenever you're working on a computer, for example, and you have an interactive screen, it can be difficult to find things on the screen. And this person is looking for the numbers 1, 2, and 3. So scanning is really, really important to be able to do, but with this kind of a functional impairment, it's very difficult to be as effective or as fast as your sighted peers. And there's that number 3 just popping up, as opposed to a sighted classroom student, they could just automatically see the 3. And then we have a night scene or an early morning scene. Maybe your student's walking to the bus stop, and the left field view on this particular screen, you can see with normal vision, and the right field view is the retinitis pigmentosa in action with pretty extreme situations here. Because the cones are so damaged, it is very difficult to get a solid image to navigate from. So the reason that we're concerned and what we're looking for here is that now my screen doesn't, there we go. We want to really pay attention to some annual eye exams and monitoring where your child's field loss right now may be impairing things much less so than somebody who has advanced vision loss, advanced retinitis pigmentosa. We want to stay on top of those annual exams, stay in touch with the TVI and the O&M instructor, because the functional implications in the classroom are going to be very significant as that student's vision continues to change. And we want you to know that we're here for you, that we can explain things as best we can if you start noticing those changes, things that you may not necessarily get from your eye doctor. We want to refer your student for an O&M eval. Specifically, we'd like to request a Humphreys field test just to see how extreme that was. Our functional vision assessment doesn't allow us to really pinpoint where her best vision is at this time. It's kind of limited, and that Humphreys test is going to fill it in a lot more for us. And we'd also like to request a hearing evaluation, because in a significant number of students with Bardet-Biedl syndrome, they do have hearing loss, and this is going to be a big deal, especially for orientation purposes. And that is that.